more I read about empathy and the research being done on empathy now, the more I understand that it plays a big role. That there's an equalizer that occurs when you place your hands on a patient. Practicing this really unparalleled aspect of placing your hands on another human being with no intent other than to deliver comfort. That's big. That's really big.
I found osteopathy the first time because of my daughter. When she was very, very young, she started getting ear infections. And I was blessed to be working with an internist. He said, "You will not give her surgery. You will not put plugs in her ears until you go see this amazing osteopath." So, like the good girl that I am from Kansas, I did that, and I took her, and a doctor literally worked on her one time, and she never had another ear infection.
To perceive what's going on at the deepest level, at a level of cause, through your hands, requires a suspension of a lot of the directive or ego-driven functions of a physician. To us, a great service is when we treat someone and it initiates a process of self-correction and reestablishing of balance that continues to evolve for days, weeks, months after they leave. That, to us, is a great treatment.
I went because I had just given birth to my first child. She was a newborn infant, and I had trouble carrying her up the stairs. It was very painful because of my neck. And I had bought, all the baby stuff. I had a baby sling, and it was really painful for me to carry her up the flight of stairs, and she was less than 7 pounds. And so I was depressed about that. I felt really bad, and I thought, what am I going to do? So I had not very many treatments, and I can happily report that I carried my child up the stairs until she was 4 years old, which is quite more pounds than that, purely through the osteopathic treatments that I had. That my neck was a much better neck after that. So then my children go, I go for a lot of things.
And when it comes to osteopathic treatment, the human body will always takes what it needs from the osteopathic treatment, no more, no less. And it will shift, it will change, it will adapt. Oftentimes I feel like I'm kind of in the bleachers watching the process as the body unfolds and releases these dysfunctions and optimizes itself.
I saw things happen that, to my understanding, were impossible for patients. I saw a man come in with 25 years of sciatica, get up on my teacher's table, get a treatment, get off the table and say, "Doc, I feel completely better, thanks," and walk out the door. And he's this farmer. He wasn't going to get real excited about it, but how can 25 years of sciatica go away? I mean, that's not really supposed to be possible.
I tend to attribute the fact that I'm here, alive, and well, to osteopathic care, because I think it treats all of me. So I'm very careful about any medication that's given to me. I find out what it's all about, and sometimes I tell them, sorry, don't mess around. Pills are only going to knock it out momentarily. If you want to get it fixed, see a DO.